Hello everyone, in this video I will demonstrate how to place EEG and NIRS sensor on our infants. The things you will need here are your EEG cable, your NIRS cable. There are two outlets to connect. Typically for consistency, we recommend connecting to the first one. We also need a pediatric EEG sensor and a neonatal NIRS sensor. On the other side, we have an alcohol swab and surgical lube. Any type of water-based lubricant would work. We also recommend having a baby hat. Here we have two knit hats and also Tegaderm or thin film to help stick the sensor on a baby. So before we get started, the first thing I would recommend is to turn on the EEG monitor. After the monitor has been turned on by pressing the power button on the side and plugging in the cables for EEG and NIRS, we should see a screen that looks like this. The top part is EEG showing 4 channels, and the bottom 2 show NIRS. Typically we would only see NIRS number on one side since we're using one sensor connected to one port. And to check EEG signal connection, we could do a swipe down. Currently nothing is connected, so it's all blue, but our target is green or yellow for each of the 6 EEG leads. So now we'll get started with placing the sensor on a baby. The first thing I would recommend is using an alcohol swab to clean the baby's forehead gently. This removes excess oil. We can also use this to push the hair out of the forehead to give ourselves some more space to put the sensor. Because the EEG is harder to place, I would recommend placing that first. So this is the EEG out of a packet. First thing I recommend is removing the lateral leads, the side leads. Next, we want to put the central leads on the head, and our target is to be as close to the eyebrow as possible. So here we peel off the sensor, and just be wary that there is gel, there is lube in the middle where the gray is, so make sure you don't touch it or squeeze it, otherwise you may lose some of the contact gel. So I start off by placing the leads closest to the eyebrow, typically as close to the eyebrow as possible. When I put it down, I want to make sure that I do not press the middle. I just want to press the side so the gel does not come out. Then I press the top, and finally, once that is all secure, then I remove the lateral side leads. And sometimes, depending on a baby's forehead size, you may not have enough room, so you may need to fold the leads to get it in closer contact. So here's the right lead, here is the left lead. So after that, I typically use some tape. So typically we recommend using paper tape, which is less abrasive, and I put some tape on the bottom leads to secure it. And just keep in mind to be careful of touching the middle of the sponges. And sometimes, let's say if you accidentally squeeze some of the gel off, you can use some of a surgery lube and just place it right in the middle of the sponge. Just place a small amount without squeezing it out. Next thing we want to do is we want to connect our sensor to make sure we have a good connection. So we connect it here, and then we go back to the 6 leads on the screen that I demonstrated earlier, and you would expect it to be at least yellow, if not green, for good connection. So assuming that you have good connection on the EEG, here is the next step for placing the NIRS sensor. So there's an adhesive part behind it. We take it off, and typically, depending on the forehead size, you would pick either the left side or the right side of the brain. And if you look closely, you can see the 3 dots here. That indicates where the light is sensed and where the light is also emitted. You want to make sure that these 3 dots go directly on the skin instead of going on the tape or the EEG sensor. So in this baby, I'm going to put it on the right side of the forehead, and I want to make sure these 3 leads stay on the skin. After that's done, I will plug this into connection 1, which is our default, and typically within 15 seconds or so we would see a number show up on the screen where the O3 NIRS sensor is. And sometimes when we're not able to get good contact, I would also recommend using Tegaderm to stick to the side of this to make it extra sticky. So here I'm going to put it on the right side, and I'm going to put another one right on the middle. And because we're wary of patient movement during surgery, the last step that I recommend is using either a baby hat or some type of bandage to put on top of both sensors. It's especially important for the EEG sensor because they are more sensitive to noise, and also NIRS, which are sensitive to ambient light. So this cloth, this hat, would also help prevent ambient light from entering. So in this case, I'm going to put it right on the forehead, gently lift the forehead up. Notice that the hat or the band is cut on the top, so your sensor connectors can still be connected to the cables. Next, I'm going to show an alternative way of placing the NIRS sensor. Let's say if your baby has a lot of hair, has a low hairline, or it's a small baby and there's not enough forehead space to put it on one side. So instead of placing the NIRS sensor on one side, an alternative is to have the NIRS sensor cross over the EEG sensor. By that, I mean take this NIRS sensor off. Again, remember the 3 light emitters and sensors. You want to make sure that these do not cross over or are not attached to the hair or the EEG sensor. So in this case, I'm going to do a bridge and have it go across the EEG sensor. And conveniently, on the back side, you can see where the light sensors and detectors are. In this case, I know for sure that these are not on top of EEG sensor. And again, to secure it better, I would recommend using Tegaderm to cover over this. And finally, to put the hat over the baby. And as always, just make sure that you check your monitor to make sure that you're getting the appropriate value. In this case, our EEG is not connected to live baby, so this is what you expect. And our bottom down here, the 82, is our NIRS number.